right, we are here with our What the Chuck feature, and our friends at SMA, Sports Medicine Associates, are going to give Chuck some info on what he needs to do for his latest set of injuries. And today I have with me, you want to introduce yourself?
My name is Keith Taylor, and I'm a certified athletic trainer at Sports Medicine Associates. And we provide coverage to a lot of high schools and clubs in the area. And Ultimate Football Club is one that we take a lot of pride in. Chuck has suffered a sprain. He's also had a strain here in this early season. Sprains are actually tearing of ligaments, and ligaments actually attach bone to bone. They're often confused with strains, and strains are injuries to tendons, and tendons are muscles, and tendons attach muscle to bone.
So how can you tell if you strained something or if you sprained something? Does it feel any different?
Generally, it's the location of the injury.
Okay.
And that's a great question. Most of the time, if the pain or the swelling is at the joint and the joint line, then generally it's, you would consider it to be a ligament injury or sprain. Whereas if it's more along your muscles, above or below the joints, you would think of that as more of a strain.
So how would you treat something like this?
RICE is an acronym that stands for Rest, Ice, Compression, and Elevation. And that tends to be a great home treatment method.
Now, if they wanted to find out how these guys are going to have a hard time doing the R part, the rest, because they want to get back out and play as soon as possible. In general, about how long should you try to rest an injury?
Generally, for grade 1 injuries, which are your most minor injuries, 2 or 3 days rest.
Okay.
Generally.
All right, so they can get right back out and start playing again the next week.
Absolutely. Most of the time, if it's, generally time is going to tell the severity of the injury.
Okay. Now, and you guys have a series of programs here to help people like our guys who are trying to get back into shape and go out there and play football. Can you tell us a little bit about that?
We have a fine orthopedic staff that can handle anything that's on the more severe basis. We also have a physical therapy staff that's second to none. And from an athletic training standpoint, we have a program called Sport Specific Training, or SST, where we work on general body fitness, improvements in strength, flexibility, endurance, and that type of thing. And we'd certainly be glad to talk to anybody, and just give us a call.
Okay, great. Well, we will be seeing some more of you because I'm sure Chuck will have more and more injuries as we go along. But thanks a lot for your time, Keith, and we appreciate having SMA as part of our supporters.
It's our pleasure.
All right, bye.